The next step that I'm going to take is to do my surgical scrub. Before I do my surgical scrub, I want to make sure that I don't have anything on my hands, fingers, that my scrub top is tucked in. I already put my hat and mask on before I open my sterile packs, but if you hadn't opened those yourself, then you need to make sure that you do that before scrubbing. Another thing that I do before I scrub is I switch the scrub that's in the packet into the sponge. If you don't do that, sometimes you'll have a lot of scrub that's left over in the packet, and so it doesn't lather as well. So I'm gonna squish that around, and I'm gonna open my package. And I'll stand over here by the garbage. So when I open the package, I'll have the brush side, the sponge side, and then I'll have a little nail cleaner. And you can appreciate here, if I hadn't squished that scrub into the packet, how much would have been left, especially in this one. It's all kind of concentrated on that side. So I'm going to take the brush out, throw away my package. At this point, I cannot set the brush down ever again until I'm done. If I set it down and pick it back up, it's been contaminated, and so you would need to re-scrub. So this brush is in my hand. Now, if I didn't want to hold it in my hand, I could have left it in the package and set the package on a ledge, but unfortunately with our scrub sinks, we don't really have a good ledge to put a scrub brush on, so it's better to just hold it in your hand. Then the next step, you can have some variation. You can either clean your nails out prior to applying scrub, which is fine, or you can get yourself lathered up. And here at LMU, we teach you to lather every area that you're going to scrub, so from your hands to your elbows, right away. And again, that's because the main determiner of removing your bacterial counts is the contact time of the scrub. So the longer that's on there, the better. So then I can clean out my nails, make sure that they are have everything out of them as best as I can. When I'm done with the nail brush, I can either, if a garbage isn't close by, I can just drop it in the sink and someone will get it later, or you can drop it in the garbage. So at this point, I have my contact time started, so my 5 minutes would have started when I put all this scrub on my hands. But now I'm going to systematically go through and brush every surface of my hands and arms in a systematic manner to make sure that I'm removing as much of the bacterial flora as possible. The first place to start is the tip of your fingers, and it's really important to spend time around your nails and under your nails. Even though you clean them out with a nail cleaner, the nails are the dirtiest place, and your cuticles are the dirtiest place on your hands, and the place where bacteria accumulate readily. So I'm going to spend some time doing that. You can either alternate fingers and do that, or you can just stay with one and do the entire thing. That's up to you. So I'm going to stay with one hand. I'm going to do my fingertips really well. And then I'm going to systematically go through and scrub every surface of my fingers. So to do that, I kind of divide my fingers into quadrants and just apply brush strokes. Again, we don't count brush strokes here, but just apply enough that you feel like you've gotten that area quite clean. And then you rotate your finger, do the next side, and then do the next side, and then do the other side. And so I'm going to do this for every single finger. And I'm going to be very, very methodical. Doing things like this, not effective, okay? Because I'm not going to really get a good scrub on my epidermis. So really important to go back and forth with even strokes. And as far as pressure that I'm applying, I'm not applying so much that I'm taking my skin off, but I'm definitely applying enough pressure that I'm trying to get those surface epidermal cells off. And during this process, you may have to add a little bit of water to keep yourself all sudsed up, and that's fine. You want to keep that soap on your skin. Once I'm done with my fingers, then I'm going to do a really good scrub on the back of my hand, making sure I get between my fingers really good, because that's another key place where you're going to miss your scrubbing. And then I'm going to spend quite a bit of time on my palms. because the palm has so much dry skin, it's more prone to trap your bacteria than areas on your hand that have softer skin. Again, also making sure that you do every surface of your hand. Okay, so once the hand is done, then I'm gonna just follow down and brush my arms lightly. Again, you don't wanna take your skin off and get them all sudsed up. So again, if I'm running out of suds on my hand, I'm just gonna apply more, and then I would do the same process on my other side. Once I'm done, then I'm going to drop the sponge into the sink. One thing also when you're scrubbing, it's really important to keep your arms away from you and to make sure that your hands are never lower than your elbows. So at least horizontal or level with your elbows, or if not, a little bit above. You also don't have to feel like you have to bend over and keep your hands in the sink. As long as you're standing over the sink, it's going to get the worst of the scrub. And unlike when you wash your hands at home where you're cleaning up after yourselves, it's not as big of a deal if you get scrub all over, because it's more important that you get your hands and arms clean. So again, once I'm done, then I'm going to drop my sponge, and that would have been after doing a 5-minute scrub. If you've brushed your hands and you still have a couple minutes left, you can either just use the sponge on your brush to keep lathering, or you can even just use your hands and just keep spreading your scrub around. It's really important though to not go past your clean area when you're doing that. So once you've had your 5 minutes, then you're gonna rinse. And again, this is totally different than when you wash your hands at a kitchen sink or something like that, where you want to keep the water going into the sink. Here we want to keep the water from going to the tips of our fingers. So we're going to hold our hands under the faucet and keep and let the water run from the tips of our hands to our elbow. And then same idea with this one. These things are a little tricky sometimes to keep the, okay? It's not critical that you get all the scrub off. If there's a little bit left, that's okay. It'll come off when you dry your hands. So then once my hands are rinsed, I'm gonna let them drip a little bit in the sink, but then I'm going to hold them in my field of vision. So they can be, you can either go like this, you can pray, you can go like this, whatever you want to do. You can even hold them like this. You just can't hold them like this, or too much to the side or up, because then I can't see them readily with my hands.